Hello, my name is Camicia Weston, and this is my presentation for the course One Health, One Medicine, a Sustainable Approach. My topic today is the effects of cervical cancer. Cervical cancer is one of the most devastatingly underestimated illnesses in the world. Frankly, lots of women are of the opinion that it will not happen to them, that cancer is hereditary. Wrong! It can happen to you. Cervical cancer is not hereditary. Now, what is cervical cancer? It forms in cells that line the cervix, basically in the neck of the womb. This type of cancer may not have symptoms in its early stages, but it can be detected through regular cervical screenings, also known as pap smears. The risk of a person developing cervical cancer depends on many factors such as age, genetics, exposure to risk factors, including some potentially avoidable lifestyle factors. Human papillomavirus, or HPV as it is commonly known, is the main potentially avoidable risk factor, linked to an estimated 98% of cervical cancers in the world. Other factors are smoking, HIV, and prolonged use of oral contraception. A little more about HPV. HPV is a group of viruses that affect your skin and moist membranes lining your body. There are more than 100 types, and about 30 affect the genital area. The genital infections are quite common and highly contagious, and some types cause genital warts and abnormal tissue growth, leading to cancer. There are two main types of cervical cancer: squamous cell, responsible for 80% of cervical cancers, and adenocarcinoma, responsible for about 15 to 20%. The others include adenosquamous cell cancers, which is, a mixture of the first two, clear cell cancers, small cell cancers, neuroendocrine carcinomas, lymphomas, and sarcomas. Doctors may use different types of diagnostic tests to gather information in order to determine the stage of the disease. These stages range from 1A, 1B, to 4A and 4B, with 1A being the beginning stage and 4B being the stage with the worst prognostic, as the cancer has spread to other organs, even those far from the cervix, including the lungs. Early stages may not have symptoms, but if you notice abnormal bleeding during or after intercourse, between periods, post-menopausal bleeding, unusual vaginal discharge with a pungent odor, discomfort or pain during intercourse, and inexplicable back pain, seek your doctor's advice, as this may be cause for concern. 99.7% of all cervical cancers are caused by HPV infections. 4 out of 5 sexually active adults come into contact with HPV in their lifetimes. About 13 types of the 100 plus are linked to cervical cancer. High-risk types, those are known as, with types 16 and 18 being responsible for 70% of cervical cancers. There are usually no symptoms associated with high-risk HPV infections, so it is important to get regular screening. While HPV is the main risk factor, other factors such as not attending cervical screening, factors like smoking, multi-partnered promiscuity, and becoming sexually active at a young age increase the risk, as well as having a weakened immune system. People suffering from AIDS, lupus, things like that. Cervical cancer can be treated using clinical trials, surgery, radiotherapy, and chemotherapy. Concerning everything we've covered, my belief is that the biggest issue is lack of knowledge and education, and as a result, lack of caution. As HPV is the most common cause of cervical cancer, it is almost 100% preventable. I must address what I consider sustainable solutions to prevent and manage cervical cancer. Firstly, with vaccines now available to provide protection against the 2 strains of HPV that cause the vast majority of cervical cancers, I suggest the implementation of the vaccine protocol in schools and clinics for girls and boys ages 11 to 15. This approach may seem radical, but when you consider the incidence of premarital sex has risen amongst the youngest generation, you may reconsider. Also, abstinence, age-appropriate intercourse, monogamy, self-education of risks, regular checkups, more popularized campaigns, and mandatory health classes are all ways to lower the risk of cervical cancer. I do hope this presentation was educational. Thank you so much for listening. And remember, prevention is better than cure. Thank you.